Masters in Public Health. It's really nice to see you here. So I'm going to crack off in a minute and I'll just speak about the agenda for this session. But why don't we start by just introducing the presenters briefly, and then I'll take us to the agenda. So shall we start with Zin? Would you like to introduce yourself, Zin? Zin, we can't hear you. Are you on mute, maybe?
Sorry. Can you hear me?
Yeah, perfect.
My apologies. Hi, everyone. My name is Zin. I am working with the local public health team at Cardiff and Vale University Health Board at the moment. I was a student with MPH from 2022 to 2023, and I graduated in 2024.
Thanks so much, Zin, and thanks for joining us today.
Thank you. Thanks for having me.
Hello, hi, my name is Dr. Rafia Muslim, and I'm a lecturer here in Global Health and Health Policy at Cardiff University. I work with Emily, and sorry, I have a background in medicine, so, very happy to share any information that might be useful for everyone.
Fantastic. Thanks, Revere, and thanks so much for joining us this morning. So my name is Emily Stegel. I'm the Programme Director for the Masters in Public Health. So I'll be chairing this event today. So alongside my role leading the MPH programme, I also work as a consultant epidemiologist in Public Health Wales. So I have a split role working in public health as well. So without any further ado, I will just share my screen and share with you the plan for this session. Are my slides showing okay?
It's sharing on a different screen for me, but it's in one of the small screens on the side.
Okay.
Oh, yes. Apparently you have to click on the bring content on screen and then, yeah, now I can see it.
Brilliant. Thank you so much. Great. Okay, so the plan is for this session to deliver just sort of 3 short talks about sort of 10-15 minutes each. So I'll start by talking a little bit about what is public health for those of you not working in it currently, just to give a bit of a flavour, and to talk about what it's like studying public health in Wales specifically. Then Rabia will be talking a little bit about the MPH and about the course and how you'll be taught and supported in your studies. And then finally, Zin will share a bit about his experiences studying on the course as a student and sort of what that's meant for him now that he's working in public health. The question and answer box is available at all times during the session, but once we've finished those presentations, we'll sort of go through those questions and answer those. Okay, so starting off by what is public health? So I'm sure that you're aware that public health is really, really broad, and I think probably nothing has brought public health more into the public consciousness recently than the COVID pandemic, and that first picture sort of represents that. So when we think about public health, we can think about threats to our health and how we respond to those, how we protect the population from harm. Sometimes we think about public health as the delivery of particular health programmes, and particularly prevention. So that image in the middle there is from the NHS breast cancer screening programme in Wales. So we can think about the organised delivery of health prevention programmes and services. And within the MPH, we think about how we improve health. And then the final picture there, this is of a hospital trust in Wales, and it shows a non-smoking sign. And there's a few things in that picture. It speaks to how governments can put laws in place or policies in place to protect health. So we have a policy in Wales about hospitals being places where you're not allowed to smoke. So it speaks to that sort of policy and the role of government in public health, but it also reminds us that healthcare services and being able to access safe and fair, equitable healthcare services is really important in the delivery of public health. So that slide is to just sort of give a bit of a flavour about the different parts of public health and the breadth of it. And I'm just going to offer a definition of public health. So this was proposed by a former chief medical officer, so a senior civil servant within government in the UK back in the 1980s as a definition of public health. And I just wanted to pick out some parts of that. So that first part of the definition mentions the science and the art of public health. And we try and reflect on both of those in the teaching on the MPH. So public health is very much a science. And so we look at sciences like epidemiology and statistics, and certainly when we go out and practice public health, we are looked to as experts, scientific and technical experts. But the practice of public health is more than just the science. It's also about the art. So how do we improve health? How do we work together as a system to protect the population? And thinking back to that last slide with the picture of the the SARS-CoV-2 virus, in the response to COVID-19, there was definitely science being used there. So the science of understanding the virus and how it impacts the population, the science of developing vaccines, etc. But also the art of public health. So how do you stand up the, and just coming to the end of the definition there, the organised efforts of society. How do you bring together the organised efforts of society? So multiple different functions, how do you bring them together and work together to tackle a novel threat like an emerging virus? The other thing we reflect on in terms of the breadth of public health is the wide range of things which influence your health. And this is summarised in this picture here, which you might have seen before, either in your work or previous study. So we think about health in its broadest sense. And so in the practice of public health, we think broadly about the interventions and the organisations that can help to support health. So everything from, in the middle there, you've got constitutional factors like your genetics. So we study genetic epidemiology, through individual lifestyle factors, so things like smoking, alcohol, obesity, the importance of community and social networks in determining your health, and therefore the importance of working with communities to improve health. And then broader than that, you've got the whole range of the sort of social determinants of health and the general economic and political situation in which we live determining health. And so particularly in a global context, we might focus on that, but also locally in Wales, the sort of structures that are available to us to leverage to think about optimizing health for the population. So what do, if you're thinking about a career in public health, what do we do in public health? So what is there after the MPH? So obviously Zin's going to talk a bit more about this from a personal perspective, but I think this list is quite helpful. It comes from the Faculty of Public Health in the UK to orientate us to who works in public health. What is public health? Well, I suppose the first thing to say is that you can see from the previous slide that actually public health really is everyone's business. Public health is the whole of society. And so the really nice thing about studying public health is that wherever you go to work, it's likely that the skills and the knowledge that you get from a degree in public health is applicable to a whole range of different settings. So particularly if you work in healthcare or in local government or in the sort of voluntary charity sector, it's likely that you will be contributing to the delivery of public health. So it has very wide applicability. People who have public health in their job title, if you like, so they work particularly within the small, relatively smaller public health workforce, probably the first thing to say then is that you tend to be focusing on population health. So rather than sort of traditional healthcare where you're working with an individual client or patient to diagnose a health issue and to put a management plan in place and refer them to particular services, within public health, we do a very similar thing, but at population level. So we look at data and information to try and understand needs in local population, what's important in terms of that population. And then using evidence, we develop interventions to put in place and we evaluate them. And as we were saying just now, that's done across a range of different organisations working together. Public health is definitely somewhere where I think we all share in common that passion for improving health, making the world a better place, for fairness and equity. So as it says there, champion those who find it hard to be heard. So that's a real key theme of public health. How do we ensure that that there is fairness in the health that people experience? We use science, we work collaboratively, and we work at all levels, so from sort of healthcare level right up to national and international policy to sort of actively change practice. So Rabi is going to talk a bit more about the MPH specifically, but just to give you a flavour, our student cohort is truly international. So a really nice thing about studying on the MPH is that whilst you benefit from learning about how public health is delivered in a small country like Wales, where because we're quite small, that those kind of different organisations that I mentioned work together quite closely. So it's quite a nice place to sort of understand and study public health. But we really do have a sort of international perspective because of you guys, because of the students that come to study on the course and the experiences that you bring. So that's really interesting. And I certainly learn stuff in my job every day from working with you guys, which is really great. Cardiff itself is a really nice place to study. So the picture in the top left there is our main university building. It's quite a big campus that spreads really across a large part of the city. But Cardiff itself is quite small, which is really nice. It's easy to get around and kind of get a feel for the place. So we're a capital city, but we're also quite small and friendly. The picture on the top right is a sort of cultural centre in Cardiff, which sits in Cardiff Bay, which is by the sea. So that's very nice. On the top left, the bottom left, is the picture of the seat of government in Wales. So Wales, for some of the government functions, so particularly things like health and education, Wales is self-governing. So we're part of UK government, but we also have a Welsh government, which is really interesting then in terms of policy making, and it's sort of an interesting context for studying public health. And then finally at the bottom there, Wales itself as a country is a really rural place. We're not far from the countryside here in Cardiff, so it's a lovely place to come and study. So my last slide has probably gone well over my 15 minutes. Sorry, colleagues who are coming after me. A bit more about studying in Wales. So I went to a public health conference in Wales a few years ago, just before the pandemic actually, and a representative from the World Health Organization was there, and I was really struck by what they said, which was that the eyes of the world are on Wales for its policy context, and they were referring to this piece of legislation that I've got a picture from here on this slide. So this legislation is called the Wellbeing of Future Generations Act. It was brought in to Wales in 2015, and you can see there in that circle there different aspirations for Wales. what does this mean? Well, it means that any time a public body makes a policy in Wales, sort of sets out what it's going to do, by law, it has to consider these things in that circle. So every time any public organisation makes a policy, they need to think about health, so a healthier Wales. They need to think about equality, so fairness. It needs to think about being a more equal Wales and also more resilient, and all of those things on that picture there. So that's really important for us in public health. So again, thinking about the organised efforts of society, having a government that assigns this importance to health and has health really at the centre of all of its policy making. It's a real opportunity for public health in Wales. And so it's a really excellent place to come and study and learn about the practice of public health. Of course, I'm biased, but but just to give you a bit of a flavour of the context that we work in here. And that's all from me. So I will just stop sharing my screen, which I might have done already. Have I stopped? I think I have. Brilliant, lovely. And I will hand over to Rabia. Thanks so much, Rabia.
Thank you. Let me just quickly shift, share. Thank you. Can you see my screen? Okay.
I think I just need to probably move it over.
Oh.
There we go. That's,
yep.
I think so. That's the right balance there. Thanks, Ruby.
Thank you. Thank you so much, Emily. And I apologize. Yes, so thank you so much, Emily, for summarizing that. And I really will support what you've just said about how the eyes of the world are on Wales, because it does keep health at its focus, and the focus on equity is so strong. So a lot of my work also has to do with that we focus on inclusion health, and we focus also on marginalized populations, so that health is a concern and a priority for everybody. So as I mentioned at the start, my name is Rabia. I'm a lecturer here, and I lecture in global health and in health policy at Cardiff University in the School of Medicine. And I'll briefly talk to you about the teaching and assessment work within the MPH program. And through this short slide deck, I hope to communicate to you and in terms of what you can expect from the course and how to succeed in this course. So one thing that would be good for you to understand is that we have a global nature to this cohort. Sorry if I'm looking to the left, the slides come on completely, like I can see the slides on my left properly. So we have students that join us from different countries and backgrounds, and that diversity really enriches the discussions and learning across programs, because everybody talks about the health systems within their countries and how public health is actually operationalized there, or we definitely encourage them to do that. So as you can see from this slide, that the MPH is actually structured into three main parts. First, if you so decide to come onto the program, you will be expected to complete a core module, which is worth 80 credits. Then you'll choose a specialty module worth 40 credits. And finally, you'll complete a dissertation, which is actually worth 60 credits. And altogether, this gives you the full master's qualification. So the core module, as you can see, is actually, I apologize, it's the cold plus flu that happened recently. So the core modules actually include statistical methodology, basic epidemiology, applied epidemiology, and health economics, policy, and planning. The specialty module, you can choose two from them per semester, or one per semester. So that would be either between health protection, health improvement, global health, and leadership and management in health. And yeah, so So our teaching philosophy is actually, the approach is that the module team and the teaching team is actually very supportive and challenges the students to think critically. We're also very student focused and or student centered, and you'll also be part of this collaborative learning environment, which I mentioned earlier, because you would be part of a cohort which has students from the global majority. And when I say the global majority, it is students who are coming in from high income countries, low income countries, and middle income countries. So that there's a lot of wealth of information and experience that comes through. We also emphasize active learning. So you'll be expected to engage, question, and apply your knowledge throughout the course. And so here I'm going to talk briefly about the teaching on the MPH. So we use a variety of methods. These include in-person lectures. There will be pre-recorded lectures as well, and there are interactive sessions. You'll be asked to take part in case studies, in group work and discussions. And activities. There are activities like the Journal Club. Emily runs one, which is fantastic, and practical sessions which help you to apply your knowledge. And the focus is, again, as I said, in active learning instead of passive listening. I think we don't do didactic, like, a person standing at the front of the lecture room kind of lectures as much, but you are expected to engage with material before your lecture. And then we have very active discussions inside and interactive sessions during class. Then, of course, assessment is a key component for teaching as well. So this is aligned with what you are expected to learn. We have clear learning objectives, and we focus on problem solving and applying knowledge to examples, real world examples, and which is just not about you memorizing facts, but you have to demonstrate your critical thinking and interpretation and analysis. You will be expected to write things like, we will teach you to how to write things like research briefs, policy briefs, how to do an analysis of a certain data set. So I mean, that's basically the kind of support and approach that we have in this NPH. Sorry, okay. So because I also teach global health, so I just thought I'd add a slide on global health as well. And I just wanted you to know that, we try to take a very broad view of global health, very critical view of global health, where we try to examine literature, research literature, and great literature that comes from all parts of the world. So we're just not focused on Western literature. So it is broad. And we look at specific global health burdens and their challenges. We look at things like globalization and its impact on health. We look at things like global health players and actions, comparative health systems of their funding, conflict, war and violence and health. We look at also people seeking asylum and refuge and their health needs, climate change and global health, and global mental health. So there's like a wide variety of lectures, external speakers and internal speakers who actually deliver these lectures. And the people who come externally, they actually cover a wide variety. So for example, they can be policymakers, they will be people who are actually working in these areas or from the private sector as well. So we try to bring all kinds of expertise to you so that you can benefit as much as you can from the course. Thank you.
That's great. Thank you so much, Rabia, for that overview. That's given a really nice flavour. And just to say that, I'm just going to add myself back onto the screen. Just to say that there's detailed information about the modules, about the learning objectives for each of the modules, and a bit about assessment for the MPH overall on the MPH website for more detail. I've also put a couple of prompts in the chat, so feel free to ask any specific questions there as well. Brilliant. Thank you so much, Rabia. I'm just going to bring Zin onto screen and hand over. Thanks so much, Zin.
I don't have slides I'm just gonna speak on my personal experience as an ex-student. I have a medical background just as the same as Dr. Rabia and Dr. Emily. I decided to do my master's in public health because of COVID. It properly changed the trajectory of my career, and I never looked back. So I started my course in 2022, and from my personal perspective, you have four core modules, and I took global health and leadership. And reflecting back now, I would have taken health improvement and health protection, which is more applicable to my current role and my current work. But nonetheless, both of the optional modules were incredible and very enriching. My personal experience as an alumni was more of a roller coaster ride, but mostly joyous. Yes, I have to admit that sometimes when it's exam period, exam season, it is extremely stressful, and there were multiple times that I had to burn the midnight oil and cry myself to sleep because I couldn't finish my revision. But nonetheless, the lecturers have all been very hands-on, very nurturing, especially Emily, very highly encouraged the students to develop critical thinking. I think that's the one thing that I really appreciate. Critical thinking it makes you who you are and how you advance in your later development as a person, and also in your future chosen career. All the lecturers have been very the approach has been very holistic, very all-rounded. A lot of focus is being placed on students' well-being as well, which is really heartwarming. So they're really they're very caring of how the students develop as a human. It's not just and instead of just seeing us as just basically just academic students, but how can we improve you? How can we make you a much better person? So yeah, my experience have been very very fruitful. And if it's not because of MPH, I wouldn't have gotten my current role. And yeah, so I'm just going to briefly talk about what I'm doing right now. So it's really interesting that Emily brought up the Dalkin and Whitehead diagram and also the Wellbeing of Future Generations Act, because that's exactly what we are striving to do, which is to make Wales a healthier place. And my current work is a lot to do with reducing health inequalities among marginalized communities, among diverse communities that are living in Cardiff. And it's because of all of the academic training and also all of the knowledge that was imparted by the lecturers, by being a student, by being an MPH student, that I can get into this role with a lot of confidence and very well prepared and equipped. And I have Emily to thank and all the past lecturers to thank. So yeah, that kind of rounds up my experience as an alumni, and I highly encourage you to apply for Cardiff Uni's MPH program. Thank you.
Oh, brilliant. Thank you so much, Zin. I promise that I didn't pay him to say that. I'm sorry to put you on the spot, Zin. Just as you were talking, and I didn't ask you to prepare this beforehand, so so please do take a few minutes to think about it. Is there anything you would have liked to have known at sort of the stage that perhaps some of the participants on the webinar are at, in terms of sort of applying and thinking about studying public health?
Sorry, Emily, can you repeat your question again?
Yeah, it was sort of at the point at which you're kind of thinking about whether an MPH might be right for you. Is there anything you sort of wish you'd known at that stage, or anything that was sort of helpful at that stage? Does that question make sense?
Yeah, so I would say that it's very different for different people, but from my personal experience is that because I've seen how COVID was managed in different countries. I'm from Malaysia, so COVID knows no barriers. No borders, so every country was affected. And I saw how COVID was managed in my own country, and I realized that there was so many discrepancy, there was so many gaps that needed to be filled, and I feel like I want to contribute to improving public health on a global scale. So I chose to so I applied for Cardiff Uni. But I have to say, I didn't know that Cardiff was actually the capital of Wales. So initially I was like, oh, this is going to be a country, this is going to be a place in England. But then when I came here, it's like, oh, no, Wales is a different country. Yeah, so the deciding factor for me to apply for public health is personally, I saw the gaps and the discrepancy with the management of COVID within my own country, and I wanted to contribute. So thank you. That's it.
Oh, thanks so much, Lynn. That's really it's really interesting to hear that actually about Wales versus England and that kind of because I mean we're a small country.
Yeah, I deeply apologize for being so ignorant before coming here. So, but yeah, now I know Wales is a fantastic, such a rich country, so cultured. There's the own language. I'm currently learning Welsh. My partner is Welsh, so I'm currently learning Welsh to kind of to even understand more of the local society, and that's what coming to a different country to study really enriches you as a person as well. It's not just about academic improvement, but also culturally, and also how do you improve generally, a holistic approach of how do you improve as a person, which is why I feel like it's very beneficial for anyone who wants to come to study in Cardiff Uni, because you get a different flavor than somewhere, let's say in England, where you get to understand, like, oh, you see a street sign and say, wait, there's two different languages, and it's like, oh, one is Welsh, and that kind of like opens up your mind and widens your horizon. So yeah.
Oh, that's a really interesting insight. Thanks, Zane. And I didn't point out on that specifically on that wheel of colour from the Wellbeing and Future Generations Act, but one of the things on there is about Welsh culture and Welsh language, which is really interesting because as you've identified, that sort of cultural context and the context that we practice health in is important both in terms of how we deliver our interventions, but also important as a determinant of health in its own right, isn't it? So no, that richness is really relevant. I often hear my colleagues say when they're talking about Wales, if we can't deliver it in Wales, we can't do it anywhere, because we are quite a small nation and we have our own government in relation to health, and we work very closely with Welsh Government in Public Health Wales. And thank you for sharing the insight about COVID. I wonder whether we haven't got data on this, but I wonder whether post-COVID lots of people have come into public health because of COVID, because it was such a big thing. I've popped a question in the chat there just to say please feel free to add any comments in relation to public health and any interest that you have particularly. I'm sort of happy to be interested to see that, but also happy to sort of share how maybe your interest might fit into the course. I've also popped a question in there specifically about how the course is delivered. It's sort of any questions that you might have more about the specifics of the course. So please feel free to add comments to those, and we can try and answer those. We've got about 20 minutes left in the webinar, so if you do have any questions, we can pick them up from the chat and cover those. I'm just going to while you're having a think, and if anyone does want to post, I'm just going to share my screen again, because I've got a slide which has a link to the website.
Sorry, Emily.
No, please go for it.
Sorry, Emily. Hannah Smith has asked a question. How many days a week? Yeah, how many days a week would you be required to be at uni? And is it all taught at the key campus, including lectures?
Thanks, Rabia. Do you want me to pick that up to begin with? So I'll just leave that QR code up just while I'm talking. So it's hopefully clear in the red text, but on the left, that QR code takes specifically to the Cardiff MPH page. The QR code on the right is to all our postgraduate courses, and you can access the MPH page via that as well. Thanks, Hannah, for the question. So, at the moment, and for this year, and there's no plan to change this for next year, we teach the way it works. So you can either study the MPH full-time or part-time. If you're an international student, there isn't a part-time option. Unfortunately, it needs to be a full-time course. If you're resident in the UK, then you have the option of full-time or part-time. The courses are identical in terms of what we deliver. It's just how long it takes you to do the MPH. So if you're full-time, you would study 2 core modules and 1 option module in the first semester, which runs from about the beginning of October until the middle of December. You would do your 2 core modules on a Wednesday, and it's like a short day on a Wednesday, so sort of 10 till 4:30 or something like that. And then the option module on a Thursday morning, sort of 10 till 12:30, something like that. And then Thursday afternoon is then free for, sometimes we run additional things on Thursday afternoon, like study skills or journal clubs, or we start doing preparation for thinking about dissertation, sort of from fairly on in the course. So we've got that sort of Thursday afternoon for picking up those sort of things. And then the same thing in semester 2, which starts after the exam period in sort of the 3rd or 4th week of January, something like that, and runs up to after the spring break until about May time. Same model, so core modules morning and afternoon on a Wednesday, and the second option module that you choose would be on the Thursday morning. And then if you're successful and pass all of your modules from your talk phase, you would then progress to dissertation stage, which then runs from about May, June time up until sort of early September, when you submit your dissertation. So that's the teaching model for the full-time course. If you study part-time, you come to the same teaching days. It's just that you do your core modules in the first year. So you would do morning and afternoon on a Wednesday in semester 1 and semester 2. Then you wouldn't progress to dissertation at that stage. You'd then have sort of the summer off, if you like, and then re-enroll in at the beginning of October. And then in year 2, you would then do your option modules on a Thursday morning in semester 1 and semester 2, and then progress to dissertation. We do work as a course team to continually review and improve our course, so based on your feedback and our reflections as a course team. We do this on a continuous basis anyway. We are looking over the next few years to maybe think about how we shuffle modules around a bit to make sure we get good coverage of the subject, and it sort of feels sensible from your perspective how everything is delivered. So into 27-28, it may be that the way I've described that structure might look slightly different, but in terms of the essentials of public health and the topic and what we've shared in the presentation today, there's not going to be a huge change, but just to sort of say that in terms of that specifics of how the course is organised, it might change a little bit over time. I'm going to stop sharing my screen now so that I can see everyone and any further questions.
Yeah, there's another question, Emily. Someone says, "Hi, I'm a nutritionist from Turkey. 2 years ago, I conducted a study on misconceptions regarding nutrition among people living with HIV. I have encountered many obstacles in the political and society. Would it be easier to carry out such a research in Cardiff?"
Oh, thank you for that question. That's really interesting. What an interesting background. So, and really illustrates the sort of breadth of public health in terms of sort of professional groups. So there's a real link there, isn't there, between nutrition and dietetics and public health in terms of those sort of wider determinants of health. That's really interesting in relation to that research question. HIV is so important as a sort of global threat to health. And gosh, how interesting that's resulted in obstacles in relation to politics and society. In terms of your question and whether it would be easier to carry out research in Cardiff. So I suppose in terms of the MPH, just to sort of explain that sort of the MPH and research. So within the MPH, we deliver teaching on research. So a lot of that is around sort of study design, epidemiology, so how we collect data, statistics, but then also how to frame a research question, how to develop aims and objectives, and then sort of taking that through to dissertation. So within the MPH, there's that scope to do that very sort of specific piece of research, if you like, a dissertation, but we're not a research degree as such, if that makes sense. So there's obviously sort of different degree options available, such as MPhil, PhD, etc. And we're sort of slightly different from that. Yeah, interesting in terms of that. Sort of that question: would it be easier to carry out such research in Cardiff? I might hand over to Rabia for her reflections in a minute, because Rabia works in a research role as well as in the public health role. You might be interested to look at websites like I'm going to get this wrong, HNIR. Have I got that acronym right, Rabia? Sort of the sort of various different organisations that sort of support the delivery of research in the UK and including in Wales. But I'll hand over to Rabia, because I think she'd be much more of an expert on this than me.
Well, we certainly do teach communication and misinformation as part of health policy. And so if you wanted to develop a research proposal, we could definitely help you to do that. The National Institute of Health Research, as Emily mentioned, that they do fund projects which are based internationally, but always the caveat is better if you have like something in with the UK as well, because that just makes your funding application stronger, if that's what the route you're thinking about going down is. There's HCRW, Health and Care Research Wales. Again, I guess, so there are connections, there are things you can do. And of course, with Turkey, Turkey might have some funding as well, which you could probably use if you wanted to develop a research project and then take it forward after your MPH. During your MPH, you can also, we always recommend that students look at the literature, like what information is already out there in terms of doing systematic review, to see how misinformation is handled across a certain topic. I think we have a student who's looking at misinformation in Sri Lanka as well. So I'm sorry, is that the question? Did I address the question, or is there like an element of the question that I ought to have? But you can also do like primary data collection. If I don't know, but it also depends on what your background in research is, right? So how quickly you're able to do those things, or is it something that you need research training from the start? So you will be given supervisor, you will have a tutor, and you can have like proper conversations with them who are all experienced in research.
Sorry, can I just supplement something from a student's point of view? Because I see the question, and I think one of the main issues is that the political and society obstacles. And from my personal point of view, I did my dissertation on a topic that I know that I would never be able to do it if I were to do my MPH in Malaysia, which is my topic. My dissertation was improving cervical cancer screening messages for trans and non-binary community. And one of the main reasons is that because of the stigma that is attached to non-binary and trans community. And one thing I love about being in the UK is that the Equality Act that was enacted in 2001, where you remove all barriers to discrimination. So there's no such thing as stigma against HIV. There's no such thing as stigma and discrimination against the marginalized community. So I think that's what another caveat of the question is, that the issue of stigma and the issue of, oh, this is a topic that I don't know if I am able to approach, because politically it's not seen as desirable, or it's not seen as something that is acceptable. So the one thing that I feel like it's going to be a big draw for students to come here is also the freedom of you expressing and you doing research and exploring all topics here without the obstacle and barriers of discrimination and stigma.
Absolutely. And one more thing. And during policy, we also teach you how to negotiate those boundaries, or encourage you to think about how to, if you are passionate about addressing the health challenges in your own country, how do you build consensus? How do you talk about stakeholder or engagement with people who are your collaborators? And how do you bring about change in society? And yeah, rules are different in different countries, but thank you. I hope that added to what Zin was saying.
Oh, thanks so much for bringing that richness to that discussion, and that example was really elegant. Thanks so much, Sin.
Emily, there's one more question. Hannah Smith asks, is there much going on in terms of course community? Assuming it's all based at Heath campus, what facilities do they have there?
Oh, thank you so much, Hannah. As I read your question, I realised I didn't pick that up. You did mention the base and stuff for teaching, so I can pick that up a bit better now. Yes, so we just for sort of colleagues on the call who don't know Wales and Cardiff. So I mentioned that it's quite a small city and that the Cardiff campus kind of spreads across the city. So we have sort of university buildings in the centre of Cardiff city, and then probably like half an hour, would you say, walk north of that is the main university hospital in Wales, where our medical school is based. And actually the MPH is part of the School of Medicine. That's how we're sort of organised within the university. Our base for much of our teaching is on that hospital site. It's sort of it's got a slightly different feel, hasn't it, from the rest of the university. It's got a very sort of, I suppose, health feel about here. So you'd be on a campus with students who are studying medicine and sort of allied subjects, and it's definitely got that kind of health feel about it up here, which is quite nice. And there's the sort of facilities here. There's the medical library. We've got a student hub up here for support from all of our kind of student support services. So just because we're a bit more remote from the rest of the campus doesn't mean that you don't have the same access to student support services up here. Then there's the sort of hospital site itself that's got kind of a concourse that's got shops and stuff where you can kind of sort of access that sort of thing. There's also kind of a student bar and not bar. There might be a bar, actually. I haven't explored that. There's a student cafe and sort of social space as well up here as well, which is quite nice. So we do quite a lot of our teaching up here. Last year, or this current year that we're in, we've had quite a nice development where we've joined up with the postgraduate dental courses to do some of our stats teaching. Because that's a bigger group, we've needed to use some of the big modern computer suites down in the main university site. The way we managed this year was that we had the sort of core module in the morning on a Wednesday up at the Heath, and then we had a bit of a break in the middle of the day, and everyone kind of walked down in groups to the main site, which is quite nice, and sort of got lunch, and then had a bit of a flexible start to stats in the afternoon, recognising that people had to make their way down and used the sort of the central buildings. Which is quite nice because then you have a slightly different feel in central Cardiff. It's a bit more of a campus feel. You've got the student union there and all of the kind of, and the big student hub with the kind of drop-in services like study skills and wellbeing and finance and everything. So that was quite a nice mix. For this coming year, I'm not quite sure how we're just sort of planning that now. It may be that we decide that rather than everyone having to kind of transfer from one campus to the other in the middle of the day on a Wednesday, we try and site all of the teaching more in the central Cardiff, or it may be that we stick more to the Heath. So it's a bit uncertain at this stage which we'll use. In terms of course community, it feels like we certainly have a really nice community, sort of learning community on the course, as Rabia described. We're a really diverse student group, and we do so we have student reps who we work with quite closely to make sure that we're meeting student need and to get kind of feedback from our students about how the course works. So that's that's a really nice model. I certainly, and Zin will be able to talk more about this, so I'll shut up in a minute and hand over to him. But definitely I get a sense on a Wednesday that when I'm going to get my lunch, I see the students all kind of having lunch together in the student cafe, and it feels like it's a really nice course community. As a student of Cardiff, of course, you have access to all of the kind of student clubs and societies, which are sort of general across the whole university. There are some specific School of Medicine-based societies. So, for example, there's a Student Medicine International Student Society, which is quite active. Yeah, but I'll hand over to Zin because I should have come to you in the first place, Zin. I apologise. What's your take on this? Is there a good community?
Yeah, so I was I self-nominate. Emily didn't choose me as a student rep. So in terms of these course communities, it's how you make of it. The lecturers are not responsible for creating like a student rep or make all of us get along with each other, but it's all of on our own efforts. So we do have a group WhatsApp group, which we still have since 2022, and that's where we air out all of our grievances in terms of like exam stresses and all that, and we share information on our own WhatsApp group. And so yeah, it's because my cohort was a very diverse cohort, so we were sharing information across about each other's lived experience. And within the WhatsApp group, it's not just talking about academic stuff. It's also talking about like, okay, so where do we want to hang out on after course on Wednesday? So that's like all the small little activities that improve cohesion and improve your relationship with your fellow cohort, which I think is really important because it provides that that support that you need, where they are going through the same thing as you, and it's more like that relatability, and you do form long-lasting relationships. I have a friend that I just attended his wedding, and he was one of the cohort students, and yeah, so it's all about how you make of it, and yeah, that's all.
Oh, thanks, Zin. Oh, that's so lovely to hear. It's really nice that the WhatsApp group's still going. That's really cool.
Emily, just before the end, I think there's one more question.
Brilliant. Thanks, Ruby.
It's kind of hard to monitor the questions. So, good on Zen that he was able to find all of the questions in the chat. I think the student, the person or potential applicant wanted to know, they have a background in computer sciences, but they've worked a lot with health and well-being groups for marginalized communities. And they just want to know that how open is the program to applicants who bring community experience, but not a formal health degree. And they also come from a marginalized community.
Oh, thank you so much for the question. So what I would say is that public health is a really broad specialty. If you have a look at the website, I'll put the link up at the end. It's got the kind of detailed information about the application requirements. You may have had a look at those already, and it's definitely the case. I think that there are some courses that are that give you that sort of grounding that in terms of your first degree that then sort of lends itself to public health. So there are some courses which are more sort of suited to public health, if that makes sense. But that's not to say that if you've got a pure science degree, or in your case, a data science background, that wouldn't be suitable for an application. And what we would look at if you've got a degree which is a bit less around sort of health is so firstly I would recommend sort of sharing the transcript to your degree, because we definitely look at that in detail and look at sort of transferability to the modules that you've studied to the sort of things that we study on the MPH, and definitely data science is really relevant, isn't it, for things like public health information, for statistics. So I'm sure you'll bring sort of transferable skills, even though your degree is in a sort of slightly different area, your first degree. But you mentioned that you have work experience as well. So with the application, you can submit your CV and a personal statement where you talk about your sort of interest in the course and your experience. I would say within that sort of talking about your experience after your degree and how that relates to public health will be really helpful. And then we would, so as a course team, we review all applications and sort of think broadly about, as I say, transferable skills and work experience. So yeah, that would be my advice.
I would say, sorry, I would say a community experience is such a complex and a very, very useful skill to have. You can get academic skills from listening to Dr. Rabea, listening to Dr. Emily when they give courses and lectures. But in terms of community skills, it's very unique to you. So it's only going to enrich your personal experience by doing the MPH. So it's very highly encouraged. And since you have a computer science background, one of the core modules is statistical methodology, which I struggle with. I'm sure you're gonna ace with flying colors for that course.
Oh, thanks, Ian. Just to say briefly, if it's helpful, we study statistics using statistical software. Rabia mentioned a bit about the teaching model before, which is a blended model. So we provide a lot of our sort of content in terms of the knowledge part of the course as pre-reading or recorded lectures or sort of e-learning, so that in our sessions we can focus on the really kind of practical stuff, which for stats means learning to code and do statistics through statistical software. And if that sounds terrifying, please don't worry, because we literally start from basics and build up and sort of work through it together. Is that fair, Zind? Were you scared off to begin with and then realised that you aced it in the end?
Yeah, I did ace it in the end, thanks to lots of coaching from lecturers. And yeah, but please, my personal experience is different from everyone. I'm sure there are lots of people that are really interested and will ace that module. But personally, just for me, I needed lots of time to properly understand that module.
Oh, thanks, Ian. Yeah, so just for sort of context, but brilliant. Oh, thank you so much for your questions. And I hope that was helpful. I'm just going to finish by posting up those QR codes again, so that.
Emily, do you mind if I add one thing? I just want to say that, I completely agree with what Emily and Zen have said about the learning, but I just want to emphasize that this is an academic degree. So you are coming onto the course to learn. So even if you're feeling a bit apprehensive about one or two subjects, it's fine, you'll catch up. We will encourage you to catch up. So.
Oh, thank you so much, Rabia. That's really important to say. And I think in terms of philosophy on the course, we recognise that public health is really broad, and all of us on this call have, all of the presenters on this call have a medical background. But I remember when I came into public health, I was a GP before I came into public health, and I just thought everyone was talking a different language. It felt really, really different. So whatever your background, we recognise that there's a learning curve when you come into public health, and really the philosophy of the course is to kind of embrace the heterogeneity of backgrounds and to learn from each other and to learn together, really, and to kind of immerse ourselves in the world of public health and sort of develop that appreciation for it as an art and a science. So if you've got a really kind of classic medical background coming into public health, but it feels a bit alien, don't worry. If you've got a sort of non-conventional background and you're thinking of coming into public health, don't worry. Fab. I did try to share. I've done something funny with my screen. It's still in presentation mode. So when I tried to share that QR code, it wasn't happy again. So apologies, I might not be able to do that. But hopefully you were able to pick it up earlier on. Great. I don't think we've got any more questions, and we've come up to our 1 hour time, gone over a little bit. So just to say thank you so much for joining us, and I'll sign off the webinar now. Thanks very much.
Thanks, Emily. Thanks, Dr. Rabia.